Good morning and welcome to the morning news segment with ArewaBlue News TV. My name is Ibrahim Sufianisa and here is the top stories for this morning. On the 31st of March 2020, which is yesterday, 8 new confirmed cases of the COVID-19 has been recorded in Nigeria. Till date, 139 cases have been confirmed, with 9 cases being discharged and 2 deaths from the COVID-19 recorded in the country. Of the 8 new cases reported on the 31st of March, 3 are in Osun State, 3 are in FCT, 1 in Lagos and 1 in Ogun State. All new cases have mild to moderate symptoms and are currently receiving care. A multi-sectoral National Emergency Operations Center (EOC) activated at least at level 3 continues to coordinate the national response activities. Sadia Farouk, the Minister of Humanitarian Affairs, Disaster Management and Social Development, says the ministry has commenced cash transfer to the poorest households in the country to cushion effects of the coronavirus pandemic. The minister said this during a press briefing by the Presidential Task Force on the Disease in Abuja on Monday. Nigeria has recorded 139 cases spread across 10 states and the Federal Capital Territory. The country also recorded its second death from the disease on Monday, and Farouk said the ministry has commenced advance payment for conditional cash transfer to the poorest households in the country. She said a vulnerable group will also be expanded to consider more persons during the infection period. The minister said the National Emergency Management Agency (NEMA) has deployed trucks of relief materials to states affected by the coronavirus pandemic. The Kwara State government has ordered the closure of its borders as a measure against the spread of coronavirus. During a press conference on Tuesday, Kayode Alabi, the deputy governor of the state, said the border closure would not affect those carrying out essential duties. Alabi also said that the government would begin fumigation of markets and other specific locations, and thereafter specific markets would be designated for people to make essential purchases like food and medicines. 31 coronavirus patients in Ghana have been discharged after recovering from the disease. Kwaku Agimiang, the country's health minister, broke the news during an interview with journalists on Tuesday. The country has confirmed 161 coronavirus cases, of which 5 deaths have been recorded. Agimiang said the 31 recovered patients will be monitored closely in their respective homes. This is the highest number of patients who have recovered on the continent so far, and globally over 830,000 people have been confirmed, and according to Worldometer, a website which provides real-time update on the virus situation globally, at least 176,000 people have recovered, while over 41,000 people have died from the disease. The National Coordinator of Nigeria Sex Workers Association, Amaka Enemo, says sex workers in the country have been forced to suspend activities, especially in Lagos and Abuja, due to the lockdown caused by the COVID-19 pandemic. Enemo told the Punch newspaper on Tuesday that although sex workers offer essential services, they will remain indoors because their services involve substantial bodily contact. She said the association had been able to sensitize its members to the dangers of the COVID-19. The national coordinator said the association would accept donations from the government or private sector, as this would reduce the number of the lockdown on members. And that is all we got for this morning news segment. Do join us later in the evening for more news updates. My name is Ibrahim Sufianisa. On behalf of the entire crew of the ArewaBlue News TV, I say thanks for watching and bye for now.
I will not stop talking until you subscribe to our YouTube channel. That's right, don't walk away.